Portland area, more than 20 healthcare workers have now tested positive for COVID-19, and nurses on the front lines are pleading for more protective equipment to keep them safe on the job. Fox 12's Simon Gutierrez heard from some of those nurses about their specific concerns.
The bottom line is they still don't feel adequately protected, despite the state and local hospital systems scrambling to load up on personal protective equipment. A lot of nurses simply don't feel safe. How safe or unsafe do you feel?
I think we're all scared. I think most nurses and most doctors and caregivers are scared, right? We see what's happening. We see that we are all being infected at high rates across the world.
Matt Calazia is a registered nurse who works in the Eugene area. He says nurses at the facility where he works are being asked to use face masks and other protective equipment in ways that go against their training because there isn't enough to go around, which threatens not only them, but also their families.
I know some folks are, taking a shower at their facility and then getting home and, taking all their clothes off outside, taking another shower.
Today, the union that represents healthcare workers in Oregon called on more action from Congress and the administration to protect frontline workers. With the situation unfolding in New York, a grim reminder of what could happen when Oregon sees a surge of critically ill patients.
Oh, and we're not even close, right? I mean, we haven't felt the surge yet that we're hearing about in New York, and sort of the devastation that they're seeing there with regard to the lack of personal protective equipment, the number of frontline workers dying. We don't want to be in that space. I mean, the fact is that the push for PPE should have been 3 weeks ago. There's no excuse for this.
As it stands, the union says Oregon nurses are reporting being asked to use single-use equipment for an entire day to ration limited supplies. Directives that are breeding fear and anxiety.
Because we don't have adequate supplies, the guidance has been to lower the standards. And that is something that nurses, doctors, everybody understands, that's just terrifying.
This afternoon, Oregon's Director of Emergency Management weighed in on the lack of adequate supplies for frontline workers. He says the state is working night and day to get more of those critical supplies and distribute them. Reporting in Northeast Portland, Simon Gutierrez, Fox 12 Oregon.